Hi, my name is Krisha Fuerte. Today I will be discussing about Alendronate. The prototype drug is called Fosamax. But first of all, I will talk about osteoporosis. Osteoporosis is a bone disease where an individual is losing too much bone, making too little bone, or both occurs. As a result, the bones become weak and may break from a minor fall or serious cases, or even in simple actions such as sneezing or bumping into furnitures. Healthy bone appears like honeycomb under microscope. In osteoporosis, however, the holes and spaces in a honeycomb are much bigger than they are in healthy bone, which means that the bones have lost density or mass and that the structure of the bone tissue has become abnormal. As your, be- as your bones become less dense, they also become weaker and more likely to break. Hence, osteoporosis means porous bone. The pathophysiology of osteoporosis. There is a balance between bone resorption and bone deposition that occurs during bone remodeling that is determined by osteoblasts, which is the formation of new bones and increase of bone mass, and osteoclasts, which are responsible for apoptosis and decrease of bone mass. Osteoclast is activated first, then followed by osteoblast, which forms and lays down fresh bone matrix. Here is an image where it shows that osteoclast and osteoblast work as a team in order to strengthen our bones. In healthy bone cycle, after bone maintenance, resorption, which is the removal of small amounts of bone mineral, happens. This is balanced by osteoblasts by depositing new mineral in the bones to strengthen it. In osteoporosis, however, there is an excessive resorption which makes the bone weak, called osteopenia, and over time becomes brittle and prone to fracture that leads to osteoporosis. And this is just a fun way to remember what could be the risk factors and causes of osteoporosis. Risk factors such as alcohol use, corticosteroid use, low calcium, low estrogen, smoking, and sedentary lifestyle leads to osteoporosis. Pharmacotherapeutics of alendronate. Alendronate is a biphosphonate. It is used to treat and prevent osteoporosis in men and postmenopausal women. It can also be used to treat Paget's disease as well as hypercalcemia malignancy. Fosamax plus D is also available, which is a drug that includes additional vitamin D. Pharmacodynamics of alendronate. So how does alendronate really works? Alendronate is a potent specific inhibitor of osteoclast-mediated bone resorption. Biphosphonate, like Fosamax, attach to hydroxyapatite binding sites on bony surfaces, especially undergoing resorption, to inhibit the osteoclast activity, which reduces the number and action of osteoclasts and slows down the bone breakdown. Biphosphonates cannot replace lost bone, but it can strengthen existing bone and reduce the damage that is caused by the disease process. On the image below, the purple creature is the biphosphonate or the alendronate, which inhibits the action of the osteoclast to break down small amounts of minerals in the bone. Pharmacokinetics of alendronate. In most cases, alendronate is well absorbed when taken orally, except in hypercalcemia of malignancy, which is given through IV infusion. It is distributed to soft tissues, but rapidly redistributed to the bones and excreted in the urine. There is no evidence about the metabolism of alendronate, but it is said that the terminal half-life of the drug is 10 years. And now we're going to talk about the adverse effects of alendronate. Alendronate can cause abdominal pain. It can cause musculoskeletal pain or the femur fracture, where it can cause severe bone, muscle, and joint pain. It has been reported that fracture of the thigh bone or the femur occurs while taking alendronate. Hence, it is important to notify your doctor if severe pain of hip, thigh, and groin persists. It can also cause acid regurgitation, esophageal ulcer, which happens very rare, gastritis, jaw pain, also called the osteonecrosis of the jawbone, headache, dizziness, rash from allergic reaction, heartburn and chest pain, erythema, and overdose of alendronate, which could lead to hypocalcemia, hypophosphatemia, and upper GI effects. These are just a few of the food and drug that interacts with alendronate. Aspirin increases the risk of GI irritation, especially esophagus and stomach irritation. Corticosteroids, especially prednisone, increase the risk of jaw problem. Antacid, ranitidine, calcium and iron supplements can decrease the absorption rate and increase the side effects. Food and beverages such as coffee, tea, and mineral water also can decrease absorption rate. Therefore, one must take other drugs and eat food and drink other beverages 30 minutes after taking alendronate. And here is a list of patient teachings and nursing implications about alendronate. Take drug with plain water at least 30 minutes before taking any food or beverages or drugs. Don't drink mineral water with alendronate because it might affect the absorption rate of the drug. Swallow tablets whole. Do not break, chew, or crush the tablet. Do not lie down for at least 30 minutes after swallowing the drug because it will not be absorbed easily and it might increase the GI irritation. Take calcium or vitamin D supplement if diet is inadequate, but make sure to take it 30 minutes after taking alendronate to avoid drug interaction. Encourage to make lifestyle changes that enhances bone growth, such as smoking cessation, avoiding alcohol, eating more fruits and vegetables, and exercising regularly at least 3 to 5 times a week. Be sure to take the drug in the morning, same time each day. Never take the drug at bedtime because it might not be absorbed and it might increase the side effects. Tell your doctor if you're pregnant or planning to get pregnant while on this drug, because remember that the estimated terminal half-life of alendronate is 10 years, so it stays longer in your body. Watch out for osteonecrosis of the jaw, also known as the OJW, which is a serious jawbone condition. Tell your dentist when taking this drug. Tell your dentist to examine your teeth and perform any needed dental treatment before taking this drug. Be sure to brush teeth and clean mouth when taking alendronate. If missed a dose once daily, do not take it later in the day. Never take double dose to make up for a missed dose, and never take more than one dose in one day. Wear sunscreen and protective clothing if going outside. Avoid sun lamps, or tanning booths. It may take 3 months or longer for bone density to increase again. Teach patient to take it regularly and do not stop the drug without talking to your doctor. Now let's answer some questions. Alendronate inhibits the action of osteoblasts in order to slow down the bone breakdown. True or false? That is correct. It is false because alendronate inhibits the action of osteoclast in order to slow down the bone breakdown. Question number 2. When overdosed with alendronate, calcium will decrease, phosphorus will increase. Calcium will increase or phosphorus will decrease. Calcium will decrease, phosphorus will decrease, or calcium will increase, phosphorus will increase as well. You're right. It is letter C because in alendronate overdose, you will have hypocalcemia and hypophosphatemia as well as GI irritation. And question number 3. The client who is taking alendronate needs further teaching if he or she states that I can lie down or sit up after taking this drug. B. I can take this drug with mineral water. C. I have to notify my dentist if I am taking this drug. D. I cannot swallow tablets. I will just crush the drug and mix it with my food. Or E. I will use hat and wear long sleeves while I am gardening in my backyard. Select all that apply. Here we are looking for the wrong answers. Therefore, letters A, B, and D will be the answers. Because an individual should not sit up or lie down for 30 minutes after taking the drug, he or she should take the drug with plain water only, and he or she cannot crush, chew, or break the tablet. And here are my resources. And that's all. Thank you for listening and watching.